Hi, this is Lee Schilling, your OBGYN physician, talking about contraception. Today's session is on non-hormonal contraception. Well, one of the questions that we asked in our first video, or YouTube, was how old do you have to be to get pregnant? This is an example of precocious puberty. That's very rare and not typical. But she was 5.5 when her body matured enough for her to have gone through puberty. I don't think they ever knew who the father really was. But she's 5.5, and that's not very typical for being able to get pregnant. Well, we've talked in the past a little bit about menstrual cycles. Okay, there are lots of variations in cycles. A cycle is referring to the menstrual cycle, and that's from day one is the onset of bleeding, and then the next cycle begins again with the onset of bleeding, and that usually takes about 28 days. Some people have longer cycles and some people have shorter cycles. But this was a study done, it's a very small study, showing when people ovulated based on a variety of pathological factors or pathology specimens. And what they found was instead of day 14, some people ovulated on day 8, 3 of them here. And some ovulated as late as day 19. So you can't really go by the calendar by itself to determine where you are in your cycle. And I'll show you some things here to try to help determine where you are in your cycle. And this, again, is just what I just said about when people ovulate. The brain determines when the egg is released. Well, let's talk about these things here, and it's important for fertility awareness based methods. And the cervix is the end of the uterus. Uterus is about the size and shape of a pear, and the small end of the pear is where the cervix is, and it usually doesn't have much of an opening, but about the time that the egg is being released from the ovary, it begins to dilate a little bit, and the secretion coming out is one that doesn't have any cells in it and is really rather pretty, and it's very, very stretchy. And the reason for all of that is that facilitates sperm being able to get inside the uterus and out to the tube. And that's where fertilization takes place. So you can see that the cervix is slightly dilated there. Well, as in terms of contraceptives, some things just work better than others. And you can see here what those are. And we'll be talking about the non-hormonal ones today. Now, this is using the cycle as a basis for understanding things. But I think if you incorporate more than one thing, what kind of mucus do you have coming out of your cervix? And you can determine that, or your partner can determine that, whoever's more comfortable. I don't know that very many people use this, but I think the people that use it usually are pretty good with it. What it's showing is that there are some days when it's okay not to use a contraceptive, and other days where the white ones are, don't be sexually active without protection. That's the most fertile time. If we look at the anatomy, what you can see is that you got 2 ovaries, and just on the outer part there of each ovary is a tube. They're called fallopian tubes. And the egg gets released, usually goes down into the tube. And if sperm are around, they're good swimmers, so they keep going up and they swim out here, and that's where fertilization takes place. Now, if the tube has been infected or something like that, and the pregnancy starts here, but it can't progress because of prior infection or something, then that can cause what we call an ectopic pregnancy, and that can wind you up in the hospital. So it has to be taken care of. It doesn't just take care of itself, and the uterus is hollow pretty much on the inside, and that's where the lining is that these hormones make grow. This is this is what the outside looks like. And what you can see is that sometimes someone has risked pregnancy and don't even realize it. They have little chance then to think about anything that needs to be done if they don't want to have a pregnancy. And both the partner and the uh, woman should always know if ejaculation has occurred, because I had a patient once who came in um, for a checkup after she had had a pregnancy termination, and I asked her, well, yeah, how'd you get? What happened to cause a pregnancy if you didn't want one? And she said, well, he ejaculated, but he never told me, and it got on, I guess, the outside, and sperm can swim in. And they're really good swimmers. They can stay alive for up to 5 days after ejaculation. And I mean, it can happen. So really, you need to be aware of that and talk with each other. Well, how long does it take a sperm to go from the vagina to the endocervical canal? That's where the beginning of the cervix. I mean, that's where the cervix is, and you can see that there's a little opening there, and that's the endocervical canal. Well, how long does it take sperm to go from the vagina to the endocervical canal? Well, let's take a look here. It says 30 seconds. That's pretty quick. So you got to do something beforehand if you don't want to get pregnant. I mean, before you get any semen in there. And then how long does it take to go from the canal, once it's inside the uterus there, out to the tube? And that's where fertilization takes place. It takes about 30 minutes. So you need to do something long before then to keep from getting pregnant. Lactational amenorrhea is another mechanism of action, and that's the nursing interrupts the usual thing that happens to release an egg. As long as they're, and look over on the right side, as long as they're nursing, is that the only way you're feeding the baby? Or do you give them a bottle? Or so if you're just only fully nursing and you're not having periods, and it's been less than 6 months since the delivery, as long as these things are going on, you won't need any other contraception. But if you aren't doing any one of those three things, then you do need another contraceptive. Well, let's talk about male and female non-hormonal contraception, followed by sterilization. Well, this is Humpty Dumpty. And so I guess there are lots of reasons to wear a condom. And these are some of the older condoms. They had Two's Company, Forget Me Nots, Non-Stops, Romeo, and these were, gosh, back in the mid 70s. I'm sorry, These were back in the mid 50s. Nowadays we use different kinds of condoms, and this was a patriotic medical student who was showing you the condoms, and we got the red, white, and blue ones. But now here are some of the different types of condoms. The glow in the darks, and some are flavored, some are studded, and most of who knows, most of the things um, help our imaginations, I think. When your partner is using a condom, you want to make sure that their end of the condom has a little reservoir in it, and what that is doing is keeping the semen from being pushed up uh, toward the abdomen and spilling out of the condom. Because remember, sperm are good swimmers. Well, if your partner says, I don't want to wear a condom, and you don't say, well, I don't want to have sex then, because it should be an equal relationship. And yet I don't know that we tell people what they have to do, but you could have an arrangement where you switch off back and forth. One time use the female condom, and that's what this is, and it's closed at one end and it's open at the other, so the open end um, goes toward the outside, and the closed end goes up uh, toward the cervix. And this is like a bag, so it's going to hopefully contain all the semen or the ejaculate. And this is how you're supposed to put it in. And you see her finger is inside the condom, and the inner ring goes up by the cervix, and the open end comes out to the outside. Well, there are a variety of things, diaphragms and cervical caps, and you can see the size on the upper left one. And the way these are used is that you put a spermicide inside the diaphragm or the cervical cap, and that side goes up against the cervix. And you can see that the lowest uh, expected pregnancy rate is 6 per 100. The typical from using these is 12 in 100. These are what cervical caps look like, and they shouldn't be used during a menstrual period. They're also used with a spermicide. But if you use them during your period, they can cause blood to go back into the tube, and that's not a good idea. How do you put that on? Well, it takes some dexterity. And what you can see here is how to do that. And then the bottom slide shows that the difference, that cervical caps, the number of people got pregnant, and quite a difference. People who had been pregnant before had a typical pregnancy rate of 40 per 100, and the ones who had never been pregnant before had a rate of 20 per 100. Why such a difference? Well, we're talking apples and oranges here, because if you've got proven fertility, and if you've been pregnant before, that's proven fertility. Then if you've never been pregnant, that's unproven fertility. And you can't compare those two things. Remember, in one of the previous sessions we had, I talked about the infertility rate globally is about 15%, equally between males and females, roughly. So the last thing we want to talk about or the next thing, are spermicides. Spermicides are chemicals. Nonoxynol 9 is one, and others are listed at the very bottom there. What they do is they cause the sperm cell membrane to break, which either kills them or slows down the movement. And they're used with diaphragms and cervical caps and can be used with condoms. Using them with condoms, uh, that's using two methods, spermicides plus condoms, and that increases the uh, efficacy a bit. And this is what they look like. They come in a foam or a cream or a gel or even a suppository. And one more thing that I'll show you. They come in a vaginal film. And you just fold this over, say, an index finger, and then take it off the finger and fold it again and just put it in the vagina and it melts. And that's got chemicals in it that kill the sperm. And then this last one is the sponge, and that's not very popular, but it's available if someone has tried everything and just can't get along with anything else. So thanks for your attention.